Have you been injured, seen a doctor, even had imaging, still hurt and don't know why? Have you been told everything looks normal and nobody can find anything that's wrong with you? Well, there are several injuries that are commonly overlooked or just simply missed. And one of them, which is what this four-part series is called facet joint injuries. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with facet joint injuries for decades now. Please remember, these videos are not a substitute for medical or chiropractic advice, diagnosis, treatment, or even prognosis. Seeing the wrong provider can result in an incomplete recovery, poor recovery, misdiagnosis, or failure to have an accurate diagnosis. In this four-part series, the first video discussed what a normal facet joint is. The second one discussed injury mechanisms. How is the joint injured? Part 3 discussed treatment. And in this one, part 4, we're going to wrap it up talking about long-term results or prognosis. So let's jump in. Regrettably, when it comes to injuries to the spine, a significant portion fail to make a full recovery. So we have to give that disclaimer or that realistic information right on the front end. Now, the studies vary, but they kind of go from a lot of different extremes. Some of the studies are rather optimistic. They show that only 10% of the population fail to make a full recovery. Others are a lot more dismal. They show that up to 70-75% still have ongoing symptoms 5 to 10 years later. So the reality is, you really can't make a big sweeping generalization, but it is safe to say a portion of those injured in motor vehicle crashes, especially sustaining a whiplash injury mechanism to the spine with facet joint injuries, a portion of them will fail to recover. Why is that? Well, it's variable. There's a lot of things to take into account. Number one is the location of the injury. Where in the body is it injured? Some areas are more vulnerable than others. Secondly, we want to take a look at how severe is it? Was this facet joint injury associated with significant disc injury at the same level, or is it just an isolated one? Are there multiple facets that were injured? Are there multiple tissues that were injured, or is it just one? How many other injuries has the person had to that body part before in its lifetime? Also, their biology. Was that area degenerated before? Degeneration is a risk factor for being more easily injured. Degeneration makes tissues brittle. It's also a risk factor for delayed recovery. Degeneration tends to not recover quite as well. Also, the person's chronological age. Really young children, they have cells that are still able to grow easier than somebody who is in their 50s or say 60s. Also, what the person does or what the person does not do with their body, with their injuries during the repair process. And last but not least, what provider or providers do they see? Do they have a team of doctors that are helping them? Are they only doing one therapy? Are they doing incomplete therapy? So there's all these factors that feed into the final recovery. So biologically, tissues in adults do not repair with original tissue with the exception of, like, say, bone. But most connective tissue, that'd be like the ligaments that hold the bones together, they repair with scar tissue. Even other muscle tissues, when they're injured, they replace with that scar tissue also. So the nerve endings that are in those areas, they can get bruised, they can get damaged, and when the nerves repair, they sometimes don't always work the same way. So in the long run, mechanically, with the different tissues, or neurologically with all the nerve endings that feed into these joints, the surrounding tissues can affect it. They may not recover, they may not repair the right way. These injuries sometimes will need ongoing management. So patients can improve to a certain point. They may have rare symptoms, they may have intermittent symptoms, or they may have kind of ongoing grumbling symptoms of some sort. So the prognosis really depends on the person being aggressively seen at the beginning with the appropriate treatment, having the right diagnosis right away, starting the right treatment right away, because the initial repair process is really tough to restart later on down the road if they saw the wrong provider and now need to see a different provider. Some patients, once they've reached what's called maximum recovery or maximum therapeutic improvement, some patients need no more care. Some patients need periodic forms of management, such as periodic medications from their provider. Some patients need periodic chiropractic management. Some patients need periodic therapy where they go back and they lose the strength in the area. They need to go back and do that. Frequently, there's lifestyle modifications that are needed. So to summarize all of this, it is vitally important to see the right doctor right away at the beginning. Because even if you do everything right, see the right providers, see the right therapist, and get the right type of intervention, even doing everything right, some patients still will fail to make a full recovery and will need some sort of ongoing management. So that is the key takeaway from this prognosis discussion. So to wrap up this 4-part series, facet joint injuries are very common. They are the most common cause of tissue damage resulting in chronic pain following a motor vehicle crash. Not all providers have the training, the education, and the experience to adequately manage these and then to order co-management with other various providers. It oftentimes takes a team to put somebody sort of back together again and to help them recover to the greatest extent possible. So thank you for taking the time to watch this video series. You have a lot of videos to watch, and I'm honored that you chose this one. Thank you so much, and have a blessed day.